Have you ever heard the phrase, would you rather speak to the nurse in charge or the CNA who knows what's going on? If you have, you've probably worked in the medical field, but if not, I will let you know what it means. The importance of knowing what a CNA does is that we do a lot of work, and I feel like some people underestimate what we do. Also, if you have grandparents or know any elderly people, it might be nice for you to know what they do on the daily for their daily activities. And then also, if you enjoy helping people, this might be a job you'd be interested in. I'm not an expert at being a CNA, but I have worked as a CNA for 2 years and then also as a patient care tech at the hospital for 6 months, and that's basically the same job duties. The daily routine of a CNA is basically summarized up: getting the resident up, passing their pills, taking them to breakfast, taking them back and then toileting them, passing their noon meds, getting them up for lunch, laying them back down, and then after everything's said and done, you chart. The job duties of a CNA could be split up between morning, afternoon, and end of shift duties. Getting them up, you wash the resident and you dress them, so basically head to toe, you're washing them up, you get them dressed. Sometimes they're not able to do that, so you have to really put in work to help them put their clothes on and stuff. We use an Easy Stand and Hoyer to help people who can't like walk, or if it's hard for them to get up. And I'll show you how an Easy Stand works. So you put this around their backs, and then you'll want to like secure them in, and you'll put their feet up on here. And then we call this a sling. You just want to secure them in, that way they don't fall out. You put them in this to take them to the bathroom, put them in their wheelchair, etc. Okay, and then you want to make sure that their feet are clipped in, this is all secure, and that they hold on right here. And you want to make sure to ask them to stand up if they can, and then you stand them up like so. And that's how you do that. So then you move them, whatever, and then set them down in their wheelchair. And that is how an Easy Stand works. So a lot of the times you'll use these to get them up. A lot of people aren't able to walk, so I'd say more so than other times, I'd use this to get people up. Thank you. So the reason people would use an Easy Stand is because they have Alzheimer's, and according to Alzheimer's Association, the website states that late stages of Alzheimer's, there's a severe decline of walking, dressing, eating, and going to the bathroom, and these activities can't be done without help from the CNA. And then this is a picture from National Aging Association of what a normal brain should look like, and then what a brain of somebody with severe Alzheimer's looks like. So obviously they've lost a lot of mass there, so their body's not going to function as a normal one like ours would. And then so once you have the resident up into their wheelchair, you want to pass them their meds. We use something called an EMAR, and on the EMAR it states what pills they'll have and the reason for their pills, and like if they need to have them crushed because they can't swallow or whatever the reason may be. So then you'll give them their meds, and then after this you'll take the residents to breakfast. Also, while doing this, you'll be answering lights all morning. So you go and answer a light, and then you get the next person up, and basically the morning is over once you have everybody up for breakfast. After breakfast, you lay down the residents for a nap, and then after everyone is laid down, you take a 31-minute break between 10 and 11, and then after that you start your afternoon duties. The reason we take a break kind of like early is so that during lunchtime we help in the kitchen with the residents, and we have to feed them, and so that's the reason for taking our break so early. And then at this point you start the afternoon duties and you get them up for lunch. You would toilet them, and sometimes you have to use the Easy Stand, or sometimes you'd have to change them in bed, and that can take 2 people. During lunchtime you pass plates and like give them their food. And then you help them assist. When assisting somebody, there's a lot you have to remember, like dignity issues. So they like wear clothing protectors, but they're actually bibs, so you can't like call them bibs because obviously they're not going to feel good about themselves if you tell a grown person they have a bib on. If they have like food on the side of their mouth, you want to make sure you wipe that off. And then after lunch, you bring the resident back to their room, you toilet them, and then lay them in bed for their nap. Once laid down, you start to chart. When you chart, you do ADLs, bowel and bladder records, and then mood and behaviors. ADLs are activities of daily living, and you basically say how the person like gets around. So like you'd say if they use the easy stand or how much help they need, etc. We chart all these behaviors so that the doctors and nurses know what's going on with the patient, because obviously the nurse and the doctor aren't with the patients every day, but the CNA is, so they know a lot about what's going on with the resident. Once charting is done, you're able to leave at 2, and this is what a CNA and Med-Aid does. Now that you know what a CNA does, you can understand how difficult the day may be and how much work we do. Perhaps if you know someone in a nursing home, now you know what their daily activity is like. So basically, to summarize it all up, a CNA gets them up in the morning, passes their pills, takes them to breakfast, lays them back down and toilets them, gets them back up for lunch, passes their noon pills, lays them back down, and then charts. Being a CNA is not for everyone, because you can't be squeamish about bodily fluids, because you're obviously taking care of all of that, taking them to the bathroom and all of that. It takes a lot of patience as well as being a very caring person. Hopefully you've learned something today, and thanks for coming.